Okay, and so benzodiazepines are a class of drugs to which most of us is exposed to in our life. And many of us have already heard of these names, which I will now name. And we know at least one person in our circle, be it a relative, a neighbor, or a friend, who uses such drugs as Xanax, Valium or diazepam, Rivotril, or Lexotanil. These are all familiar names to us. These are names that are familiar to most of us. Now, all of these belong to a class of drug known as benzodiazepines. This is the outline which I will be using for the presentation. And I will be beginning with explaining what are benzodiazepines. They are a class of drugs that cause mild to severe depression of the nerves, and their addiction is listed in the DSM-5 under the title of sedative use disorder. They have several properties, first among which is anxiolytic, and so they decrease anxiety. They're also hypnotics, and so they may make one feel sleepy or drowsy. They're anticonvulsive, and so they can terminate and are able to terminate seizures, and they're also muscle relaxing. How do they work? Well, benzos bind to the GABA receptor, which amplifies the effect of GABA. GABA is a molecule in the brain known as neurotransmitter and is responsible for most of the inhibitory transmission in the central nervous system. This inhibition is shown by the properties which can all be described as a depression of activity of the nervous system, leading to the properties which we already discussed, such as anxiolytic, hypnotic, muscle relaxing, and finally, anti-seizure. Now, these drugs are classified based on how long their duration of action lasts. They might be long-acting, such as Valium or Librium, intermediate-acting, such as Xanax, Rivotril, or Lexotanil. These are usually in the intermediate-acting section, or the ones which are used in the society. And finally, we have the short-acting ones, such as Dormicum. These are usually used in a hospital setting. A little bit about the history of benzodiazepines. They have been in clinical use since the 1960s. And the first benzodiazepine, which is chlordiazepoxide, was discovered by chance in 1954 by the Austrian scientist Leo Sternbach. 3 years later, it was marketed as a therapeutic medication under the brand name Librium. Diazepam was released in 1963, so 6 years later, and multiple other compounds followed over subsequent years. These drugs have replaced older sedative hypnotic agents, which were less safe, namely barbiturates. They have multiple uses. Among them are anxiety, to treat anxiety, nervousness, panic disorders, generalized anxiety disorder, and social anxiety disorders. They can also be used in order to terminate seizures, in order to treat insomnia, and so the inability to sleep, muscle spasms, in order to treat drug withdrawal symptoms, especially alcohol, and in general anesthesia with injection forms, and this is usually supervised by an anesthesiologist. Now, these are also known as drugs for their misuse, since they are highly habit-forming and are often misused and overused either upon prescription or exceptionally over the counter, putting the user at risk to develop an addiction. This is found mostly with a longer duration of the use, higher doses, and a lower level of education of the user. These drugs can also come with several side effects. Among them are having a dry mouth, dizziness, drowsiness, depression, constipation. Some people might complain of confusion, change of vision. With time, they might complain of weight gain. Some might develop headache, trembling. And although uncommon, but the most serious side effect is a worsening breathing problem. And so there will be a depression of the breathing, and the person will not be able to breathe well. Now, can benzodiazepines be used during pregnancy? It's preferable not to use benzodiazepines in pregnant women since these drugs can cause fetal harm if given during pregnancy. They can also enter breast milk and cause fatigue and weight loss in the newborn, which also makes them less favorable for use in breastfeeding mothers. Can one get addicted to benzodiazepines? Yes, since, as I have said, they are habit-forming and you can become addicted to them even if you take them as your doctor has prescribed. if you use these drugs over a long period of time, you can develop something called tolerance, which is requiring higher doses of these drugs in order to reach the same effect. And so with time, the longer you will use them, the more of them you will need. Now, other than side effects, what are some symptoms which we can see when we abuse these drugs? Usually we can experience disturbing or vivid dreams, irritability, hostility, and amnesia. And so we will forget what happened to us after having taken the drug. We can also experience withdrawal. Withdrawal is the combination of physical and mental effects that a person experiences after they stop using or reduce their intake of a substance. Indeed, quitting cold turkey is not likely to be successful and can be even dangerous because of symptoms of withdrawal when it comes to benzodiazepines. And the severity of the withdrawal symptoms depends on the amount and duration of benzodiazepine, with some symptoms being deadly. What are some of the symptoms? Usually we can experience sweating and gastrointestinal symptoms, usually diarrhea. We can have tremors, anxiety, perceptual disturbances, dysphoria, and psychosis. And one of the most serious side effects when stopping or withdrawing from benzodiazepines is experiencing seizures. Now, can one drink alcohol with benzodiazepines? No, it's not preferable to combine alcohol with a benzodiazepine since it's seen as dangerous. People who drink alcohol while taking this medicine will feel the effects of alcohol faster, causing further depression of the brain and respiration. Other drugs can also increase sedative side effects or the risk of respiratory depression from benzodiazepines, and these include pain medications such as morphine, fentanyl, oxycodone, and hydrocodone, and so opioids in general, or other sedatives such as barbiturates. Now, one special case of benzodiazepine is the case of Hypno. So Hypno is a tranquilizer from the class of benzodiazepine, which is about 10 times more potent than Valium. It's also known as roofies. The drug is available as a white or olive green pill and is usually sold in the manufacturer's bubble packaging. Users may crush the pills and snort the powder, sprinkle it on marijuana and smoke it, dissolve it in drink, or inject it. And the use with dissolving it in a drink is very known for the use of these drugs as date rape drug. And so Rohypnol has been used to commit sexual assaults because it renders the victim incapable of resisting, giving it the reputation of a date rape drug. This drug is sold in Europe and Latin America as a sleeping pill. However, it is illegal in the United States since it's infamous for this use. The effect of this drug starts 20 to 30 minutes after ingesting the drug. Its effect peaks within 2 hours, and its effect may last for up to 12 hours, at which point the victim collapses, lies on the floor paralyzed, unable to move, but eyes wide open. Victim is able to observe the events, but completely unable to move. And after the event, the victim can often not recall any of what happened. To diverge from this topic and go into the benzodiazepine use in Lebanon in particular, the two most commonly used benzodiazepines are Xanax and Lexotanil in Lebanon. They are used mainly for anxiety, insomnia, and depression. And their use is highest among females, especially for the cause, which is the treatment of anxiety. A higher prevalence of concomitant use of alcohol with benzodiazepines is seen, however, in Lebanese men. They are prescribed primarily by psychiatrists, followed by general practitioners. However, some can be bought over the counter or prescribed by the pharmacists. Among the people who take benzodiazepines regularly in Lebanon, almost 40% have been taking it for a period exceeding 1 year, and these people are at a higher likelihood of having developed addiction to these drugs. Now, for those interested in sharing personal stories or experience, they can do so on the forum of our website, lamsalab.org, and this can be done anonymously. If you have any concern with drug addiction or smoking cessation or any other mental health issue, don't hesitate to contact us so we can direct you to the right help. Now, if you have any questions regarding this topic, I will try to answer them to the best of my knowledge. And thank you all.